I would like to thank my dear Professor Dr. Ines for her kind invitation for me today to speak about the role of D4 inhibitors in Ramadan. زي ما احنا عارفين طبعا في القرآن الكريم يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون وغيرها من الآيات الكريمة. As we know that the word Ramadan originates from the Arabic root Ramida or Ramad, which means intense scorching heat or dryness. Some have said scarcity of rations became obligatory on Monday during the second year of migration, Hijrah. Facts about diabetes and Ramadan. As we know that fasting is an important part of many religions across the globe. The duration of fast per day, the number of days and the type of fast varies greatly across religions. Healthcare professionals treating people with diabetes need to understand the impact of the religious cultural practices of their patients on their diabetes. Consequently, this can improve the skills of healthcare professionals and the safety of people with diabetes wishing to fast. As we know that, we have more than 1 billion believers or Muslims all over the world, and 148 millions are diabetics, and more than 116 of them wants to fast. To fast or not to fast, level of risk grade, how to assess, how to minimize this risk if the fast Ramadan. Ramadan between diabetes and fasting. Although the Quran exempts sick people from the duty of fasting, many Muslims with diabetes may not perceive themselves as sick and are keen to fast. 43% of patients with type 1 and 86% of those with type 2 diabetes fasted during Ramadan. And the CREED study showed that more than 94% of the population are insisting to fast more than 15 days, while about 6% of the population insists or can't fast less than 15 days. During Ramadan, about 60% of patients change their anti-diabetic drug intake. 35% stop treatment, 8% change the dosage schedule, 25% decrease the drug dose. As you know that blood glucose levels rise rapidly after iftar in patients with diabetes, as we can see in these slides. Multiple factors influence the risk of Ramadan fasting in an individual with diabetes. What are the risk factors? Type of diabetes, individual social and work circumstances, presence of complications and or comorbidities, previous Ramadan experience, medication used, and level of hypoglycemia control. As we know that the risks of fasting, especially in Ramadan, hypoglycemia, hyperglycemia, DKA, dehydration, and thrombosis. The EPIDIAR study is a very important study and showed that 5-fold increase in severe hyperglycemia with ketoacidosis that requires hospital admission, higher incidence, which is 7.5-fold increase in the risk of severe hypoglycemia during Ramadan, while 2% of fasting patients experienced at least one episode of severe hypoglycemia requiring hospitalization. As we know that, these are the key risks: DKA, dehydration, and thrombosis. Of course, when we have severe hypoglycemia less than 70 or hyperglycemia more than 300, this usually will pull your patient towards breaking their fast. Dehydration and thrombosis is a very important issue with osmotic diuresis, volume dehydration, depletion, which all the others. So that usually in Ramadan, we should balance the risk. We are not in need for severe hyperglycemia because of the risk of hyperglycemia, DKA, thrombosis during dehydration, and hypoglycemia. We know that we have pathophysiological cardiovascular consequences of hypoglycemia. Hypoglycemia may, of course, increase inflammation. It increases blood coagulation abnormalities. It increases endothelial dysfunction. It increases sympathetic-renal adrenal response with rhythm abnormality, heart rate variability, hemodynamic changes. As we can see that CREED study have shown that in all populations, we have marked increase in hypoglycemic event during Ramadan when it was compared before or after Ramadan. As we can see here, this study have shown that we have marked increase bouts of hypoglycemia during Ramadan, mainly with patients which are more than 60 years old, so that we should be very concerned about hypoglycemia during Ramadan. And what about this relation to treatment adherence? Patients' reports of hypoglycemic symptoms are associated with significantly lower treatment satisfaction and with barriers to adherence. Impact of daytime hypoglycemia, as you can see, when hypoglycemia occurs, about 65% of the patients will break their fast, while about 31% will not break their fast and 4% may be missed. As we know that, very important for proper education and counseling before Ramadan, according to this study, because it have decreased the bouts of hypoglycemia and its incidence about more than 4-folds. As we know that, what will put the patient to break the fast if we have hypoglycemia less than 60 milligram per deciliter, or if we have 70 milligram, less than 70 milligram of blood glucose level in the early hours of fasting, or of course, if we have more than 300 milligram with symptoms of hyperglycemia. Therefore, hypoglycemia is a great risk in Ramadan, and this must be considered in selecting the proper medication. As we can see, we are in need for pre-Ramadan medical assessment and how to manage diabetic patients during Ramadan for safer fasting. And this must be associated with frequent blood glucose monitoring during fasting, and we should do it several times during day and night. So that management of diabetic patients during Ramadan is based on patient education, type 2 diabetes mellitus pharmaceutical management in Ramadan. We have a key, of course, areas to be stressed over: meal planning and dietary advice, exercise, blood glucose monitoring, recognizing and managing complications. As we know that, I will not enter in this in details, it is categorized to very high risk, and moderate to low risk. And usually in Ramadan, high and very high risk are usually advised not to fast, while moderate should, of course, they can fast, but after they have medical advice and adjustment their medications. Low risk of adverse events usually can be controlled easily during fasting Ramadan. What are you targeting treatment diabetes? As we know that, we have several pathways of hyperglycemia. One of these pathways are increase in incretin effect. So that here came several drugs acting on several mechanisms and pathophysiological pathways. One of them are DPOR inhibitors that they help, of course, incretin effect, which will stimulate the pancreas for the secretion of insulin. Considerations on choosing the oral anti-diabetic drugs. As we know that, we have 3 stages. Before Ramadan, we should do a proper pre-Ramadan assessment to categorize the risk, create individualized management plan, provide advice on self-management. During Ramadan, we should individualize management plan, nutritional plan, medication adjustment, and of course, self-monitoring blood glucose. Post-Ramadan, discuss medication regimen adjustment after Ramadan. Standard approach to the management of type 2 diabetes treatment intensification. As we know that, diet, oral monotherapy, oral combination, oral plus injectable incretin mimetics, oral plus insulin, and insulin alone. So that we should make this step-wise approach, and it's advised to be before Ramadan by 8 weeks, which means 2 months. What about our proper drug to be given in Ramadan? Use of glucose lowering medications during Ramadan. The preferred anti-diabetic drugs during Ramadan, agent with 2 important issues: sustained glucose control during prolonged fasting with low risk of hypoglycemia. If we have such a drug, it will be a perfect or ideal drug for people who wants to fast Ramadan. As you can see in this situation, overall, 50% of the patients wants to change or should change their anti-diabetic therapy, while for oral anti-diabetic, only 1/3 will change the anti-diabetic therapy, and for insulin, about 2/3 of the patient will change anti-diabetic therapy. So that if we have chosen a drug which is not in need for its dose modification, it will be a very ideal drug. Could it be D4 inhibitor? As we know that D4 inhibitor is a very well-known drug, and it has two major advantages. It is effective in lowering hemoglobin A1C, and at the same time, it is a safe drug with a very low incidence of hypoglycemia. And this was the start. They have found that, which compared sitagliptin to other oral sulfonylurea drugs, it was lower incidence of episodes of symptomatic hypoglycemic events. And hence, here a meta-analysis have shown that sulfonylurea compared to DPP-4 inhibitors in combination with metformin carries increased risk, severe hypoglycemia, cardiovascular events, and all-cause mortality. So that DPP-4 inhibitors during Ramadan may be an excellent choice to avoid the occurrence of hypoglycemia with the increase of cardiovascular and all-cause mortality. This study have shown that viltegliptin therapy and hypoglycemia during Ramadan, it was compared with metformin and gliclazide. They have found that when it's compared against gliclazide, it have lower incidence of hypoglycemia. Another study, which is vector study, have shown that also viltegliptin have a lower episodes of hypoglycemia. It was in this study 0%, no single episode more than one hypoglycemic event. It was 0% in this study. So that this is a great achievement to have a safe drug during fasting Ramadan. Another study, Virtue study, have shown that a lower incidence of hypoglycemia in the people with viltegliptin, which DPP-4 inhibitor, when compared with sulfonylurea. So that this drug is very effective, and even in the body weight, we have found that these drugs was associated with slightly lower decrease in the body weight rather than other sulfonylurea drugs. So that another study have shown that we have here showed that about 7.5-fold increased risk of severe hypoglycemia during Ramadan. And those with viltegliptin, DPP-4 inhibitors, have a lower incidence of hypoglycemia. Another study have shown that especially in elderly people who are more than or equal 75 years old, there is a risk, of course, lower risk of hypoglycemia in these elderly people, so that this drug may be ideal for young and maybe more, of course, effective in older population. What about the studies that have shown the evidence of this drug? We have several studies. This is a study which has been carried by SIFRI on 1,066. They have shown that significant decrease of hypoglycemic events with sitagliptin when compared with oral sulfonylurea. Another drug regarding sitagliptin on 870 patients have shown that a lower incidence of hypoglycemia when compared with sulfonylurea drugs. Another study in which viltegliptin was addressed, carried on 1,315 patients. It showed that there is a significant reduction of hypoglycemic effect. And regarding the glycemic control, it was more effective in reduction of hemoglobin A1C, and it was also more effective regarding the body weight in slight decline in the body weight when compared with sulfonylurea. Another study also carried on viltegliptin. It showed that we have a lower incidence of hypoglycemia, and the hemoglobin A1C was the same between it and sulfonylurea, and both groups have decrease in body weight during fasting Ramadan. Another study for viltegliptin have shown that yes, the same, we have a slight or important reduction in hypoglycemic episodes, and regarding glycemic control, they were equivalent, and body weight changes, they were equivalent. Another study also during Ramadan have shown us that there is lesser incidence of hypoglycemia by about more than 41%, and it was more effective in reduction of hemoglobin A1C, and regarding body weight, they are comparable to each other. Another study also on viltegliptin have shown the same, with significant reduction in hypoglycemic episodes, but regarding glycemic control and body weight changes, they were comparable. Another study also for viltegliptin have shown that there is reduction in incidence of hypoglycemia, while hemoglobin A1C changes and was in this situation was comparable, while body weight changes was nearly towards reduction in the body weight towards, of course, the viltegliptin. Another study have shown the same event. Yes. نعم. حاضر. Okay. أنا بخلص. These are several studies. Very important issue for D4 inhibitors do not require treatment modification during Ramadan. Several guidelines have mentioned that after metformin, it may be the drug of a choice. And another recommendation studies, such as this study, Diabetes Care, shown that the best tolerated drug, D4 inhibitors, because of its low risk of hypoglycemia. When it is compared with the other incretin mimetics, they were nearly very equivalent. Apart from that, the body weight was neutral. It has no gastrointestinal events. There is no clinical antibody formation. Regarding cardiovascular, it wasn't hard for cardiovascular because it reduces inflammation and stimulates nitric oxide stimulation, and stimulate also GLP-1 action, so that there is no harm or increased risk of cardiovascular events. And it showed that there is lesser degree of hypoglycemia and beta cell preservation because it acts through the physiological role of GLP-1 stimulator for the insulin secretion from the pancreas. So that the advantage of D4 inhibitor therapy during Ramadan, low risk of hypoglycemia, not associated with weight gain, taken independently of meals, taken orally, do not require dose titration prior to Ramadan, maintain good glycemic control. So that it had other aspects that you can reach a proper target of hemoglobin A1C, fasting blood glucose control, postprandial blood glucose control, less glycemic variability, less attacks of hypoglycemia, and less weight gain, so that you can reach by all these factors to a better quality of life. And here it may be the perfect management of hyperglycemia because of lesser episodes and lesser severity of these episodes of hypoglycemia, because they are mild bouts, recovery from hypoglycemia, proper control of fasting and postprandial blood glucose level. And usually fasting blood glucose level and postprandial, usually you have time range more than 70% with less than 4% of hypoglycemic control, with short-term glycemic variability and long-term glycemic variability. So that D4 inhibitors would be effective enough to reach hemoglobin A1C below 7%, generally well tolerated, weight neutral, non-injectable, unlikely to cause hypoglycemia, cardiovascular safety evidence without any harm. So that it will be a very effective drug, but don't miss during Ramadan. You should, for management of your cases, to individualize each case, structure education before and during Ramadan to choose the proper drug, which may be D4 inhibitors, one of these drugs. And thank you.